Hello, I'm Hannah Donnert with the Collaborative on Health and the Environment. Chandra is bringing you the latest environmental health science through our partnership calls, webinars, science serves, publications, and social media. I would like to welcome everyone to today's CHE Partnership webinar, which is titled Disrupting Cancer, Systemic Problems, Systemic Solutions. Our moderator today is Maria Valenti, Director of Common Health and Environment Literacy Project. We will leave time following the presentation for a brief Q&A session. You may type in questions through the Q&A feature available on the menu bar at the top of your window at any point during the presentation. After the presentation, our moderator will read out questions for our speakers to respond to. We will get to as many comments and questions as we can during the Q&A period. For those of you who call in on the phone, we have posted slides to accompany today's webinar on our website. You can download these by going to healthandenvironment.org. Please scroll to the bottom of the page and select today's webinar. On the webinar page is a link to the slides. Everyone on the webinar right now is muted with the exception of our moderator and our speakers. This webinar is scheduled to last for 45 minutes and is being recorded for our call and webinar archives. With that, I'll turn things over to you, Maria.
Thanks, Hannah, and welcome everyone. Today, our two expert speakers will address cancer risk as well as prevention strategies from the population to the individual level. First, Dr. Ted Schettler will address the web of causation of cancer in populations and the pathways to cancer prevention using an eco-social model. Dr. Schettler has written extensively about this topic and has been at the forefront of this discussion, including with his seminal analysis on the multi-level eco-social model that he explored in the ecology of breast cancer, recognizing that breast cancer patterns arise in large part out of conditions that we collectively create in communities and society at large. Dr. Schettler is the science director of the Science and Environmental Health Network. He received his MD from Case Western Reserve University and a master's in public health from the Harvard School of Public Health. You can read more about him on the website. Our second speaker is Dr. Todd Whitehead, who will provide an example of environmental contributors to cancer based on a chapter in the eBook and continuing education course, A Story of Health. Stephen's story follows a young boy recently diagnosed with leukemia. This chapter was recently updated with a wealth of new scientific information, much of it provided by the Center for Integrative Research on Childhood Leukemia and the Environment, Translational Health at the University of California, Berkeley. Dr. Whitehead is an assistant researcher and lecturer. He has a bachelor's degree in civil engineering from the University of Virginia, a master's in environmental engineering from the University of North Carolina, Chapel Hill, and a PhD in environmental health sciences from the UC Berkeley School of Public Health. Again, you can find more on the website about him. I'd like to give just a very brief background of this topic in general based on the writings of Dr. Schettler. Worldwide, more than 17 million people were diagnosed with cancer in 2018, and nearly 10 million died from it. Policies and programs addressing personal behaviors have been the primary focus of prevention efforts and generally ignore exposures to cancer-causing chemicals and pollutants in consumer products, homes, workplaces, and the general environment. Advocates for addressing environmental risk factors for cancer often encounter resistance. The reasons vary, but are most often traced to analyses beginning decades ago, estimating that only a few % of cancers are attributable to occupational or environmental exposures. Although many mainstream cancer organizations follow that tradition, in 2010, the President's Cancer Panel issued their report, Reducing Environmental Cancer Risk, What We Can Do Now, in which they focused on industrial, occupational, and agricultural chemical exposures, indoor-outdoor air pollution, water contamination, and other exposures. They said the previous estimates of environmental causes of cancer are woefully out of date and underestimate significantly the true toll of cancer related to these exposures. The panel called for more research, but also strongly recommended additional action based on what we already know. And with that, I'll turn this over to Dr. Schettler. As Hannah said, we will have a Q&A session at the end. Ted?
Thank you very much, Maria, and let me add my welcome to everyone who's joined. I'm going to talk for a few minutes about additional pathways to cancer prevention. What I'm showing here is the cancer control continuum taken directly from the National Cancer Institute's website. And you'll see that the continuum begins with etiology and then proceeds through prevention, detection, diagnosis, treatment, and survivorship. We're going to be talking today about etiology and prevention primarily. And I just want to note here that when you look in the etiology column, what gets listed are things like environmental factors, genetics, gene-environment interactions, infectious agents, medications, and health behaviors. And then when you go into the prevention column, it's almost entirely health behaviors. There's nothing really listed here by the National Cancer Institute that gets at some of these other issues in terms of etiology. So if we go back to the beginning at the etiology and think about the causes of cancer, obviously there are many different kinds of cancer, so their causes will vary. But it's important that we ask ourselves, what do we actually mean by the cause of cancer? Because most cancers arise from a collection of multiple factors, not exposure to single agents. So this is the notion of multi-causality, and a metaphor that commonly is used to represent that is the so-called causal web. One way that this has been illustrated that has withstood the test of time and tends to sort of represent what we think we know about, or much of what we know about cancer biology, is this notion of the sufficient causal model, first developed by epidemiologist Kenneth Rothman, where he notes that a cause is not a single component, but it's a minimal set of conditions that produces the outcome in an individual person. And it's also important to note that interactions among component causes are a primary feature of this model. So what I've illustrated here is just one sufficient causal pie for a case of lung cancer. And what this illustration is meant to show is that there are a number of wedges of this pie that when they're put together, they've created the conditions out of which a case of lung cancer can arise. And you'll see that it includes various impacts of tobacco carcinogens, for example, that mutate a pro-oncogene or damage a tumor suppressor gene, or might be in combination with an inherited defect in DNA repair, and add in some central obesity with associated inflammation. And you put these all together and you have a sufficient causal pie for a case of lung cancer. But this raises the question about what causal pathway combinations are sufficient to result in cancer development over time, and what are the implications for cancer prevention? Because if one were to remove any one or more of these wedges, even though some of those wedges would be in place, if the pie is not completed, the cancer does not develop. So this raises this concept of intercepting cancer before sufficiency is completed. More than one combination of or collection of risk factors can cause a particular kind of cancer. And I'm going to stick with lung cancer just to illustrate here. There are other component causes that can also be sufficient to lead to lung cancer. And we know that tobacco is important. And for years, of course, most of the emphasis on reducing lung cancer has been dedicated to getting people to stop smoking. And that, of course, is very important. But what we're seeing is that the proportion of people who have never smoked that develop certain kinds of lung cancer is actually increasing. So something else is going on besides tobacco. And I've just put here some candidates that we need to consider here in this section of the slide, including various kinds of air pollutants, and diesel exhaust being a very important example of that. Dozens of hazardous air pollutants, industrial chemicals, metals, asbestos, silica, radon, and radiation, all associated with an increased risk of lung cancer. So these are important candidates to keep in mind. And when we're trying to put our emphasis on tobacco as something, an individual behavioral change that's important, we also need to pay attention to these more societal level or community level risk factors. And I want to emphasize again that interactions among these risk factors are really important, making it very difficult to determine with validity what the population attributable fraction for many kinds of cancer is. And this has gotten us into a box of saying, well, if it's mostly tobacco, so we can sort of ignore these other things. And I would expand that conversation to many other kinds of cancer as well, where really knowing what the population attributable fraction is very difficult to estimate with any validity. So if we then return to thinking about these common list of risk factors that are so often mentioned that have to do with individual behaviors, what's missing and why are they missing? And I've listed here some ideas. There are certainly environmental and workplace chemicals associated with cancer. There are chemicals in consumer products that where exposures will increase the risk of cancer. Then there are neighborhood and community level variables, including pollutants in air, food, and water. And I want to just point out an example here of a community in the South, in St. John the Baptist Parish in Louisiana, is a community where, because of industrial releases into their community, they're regularly exposed to extraordinarily high levels of air pollutants that are known carcinogens. Their cancer risk is markedly higher than the national average because of these emissions over which the individuals who live there have absolutely no control. And this is just an example. There are many other communities around the country where industrial releases are disproportionate to the rest of the country and their cancer risk is elevated. And then I've also mentioned non-ionizing radiation here as something to keep in mind. This is the radiation that comes from cell phones and other sorts of similar technologies, where we're increasingly concerned about associated cancers with animal studies now that have documented increased cancer risk after exposures and increasing evidence in human populations as well. And getting back to the chemicals and carcinogens, I just want to point out some new information, new in the last few years, that is finally getting attention and is being incorporated into the evaluation of chemicals and their potential as carcinogens. And that is this notion of the key characteristics of carcinogens. This was an effort that was led by Martin Smith, who was led a committee that was convened by the International Agency for Research on Cancer that took a look at about 100 known human carcinogens and asked the question about what are the biologic effects of these chemicals? And they came up with a list of about 10 that are listed here. And this paper was published in Environmental Health Perspectives for those of you who want to take a closer look. But the point to be made is that many of these carcinogens have a number of biologic effects that go beyond simply causing gene mutations and DNA damage. And I've listed them here, and you can read them in this list. But the point being that known human carcinogens have one or more of these characteristics. Some carcinogens actually have 8, 9, or 10 of them. And so when we start to see chemicals that have been less well studied, that are beginning to show collections of these biologic effects, we need to be concerned that they might be contributing to cancer risk as well. So this now brings me to this notion of the exposome. When you begin to really open the lens and widen the lens and take a look at exposures in their totality, the concept of the exposome, it's a term that was coined by Christopher Wilde, who was then the director of the International Agency for Research on Cancer in 2005. And he defined the exposome as the exposure to all exogenous environmental agents, socioeconomic conditions, lifestyle and diet, along with markers of the endogenous processes across the lifetime of an organism or community of interest. And he did this because he thought there was a need to balance this outsized emphasis on the genome with a comparable concept that encompasses the complexity of exposures. It was an opportunity to link external exposures to the internal body burden and the internal body burden to biologic responses and disease outcomes. And so here's a graphic representation of it, and you'll see one of the important features is that it does cover the lifespan. Cancer risk and the disease risk in general begin early in life and continue throughout the lifespan. We look at all external exposures, the resulting endogenous processes across the lifespan, and then look at internal dose and biologic effects internally. And these can then be studied in these various new omics technologies, metabolomics, proteomics, transcriptomics, that integrate what has happened both from the external exposures and the internal response, that then helps to characterize the exposome and the associated disease risks. Paul Juarez and his colleagues have expanded that notion even a little bit further by coining the term public health exposome, which they see as a framework that helps to identify and compare differential levels of exposure at critical life stages and at personal health outcomes and their contributions to health disparities at a population level. So this gets at this notion of some communities and individuals in those communities who are disproportionately exposed, which can help explain some of the health disparities that are observed in health trend studies. And this public health exposome includes mediating and moderating factors at the individual and population levels. So this population health or public health exposome includes, of course, the chemicals that I've talked about at the individual level and at the community and societal level, but it also includes the social environment, things like poverty, education, employment, segregation, adverse child experiences, control in life and on the job. These can all directly or indirectly influence disease risk, including cancers. And then there's the whole mediating collection of mediating factors, which include access to resources and opportunities and measures of resilience. And the public health exposome goes even farther to include the policy environment. Which policies are in place that can obviate some of these harmful exposures, reducing risk? So this is a graphic representation of the public health exposome. It includes these personal attributes and behaviors which get so much attention, but it includes also the community level factors that I've been talking about, and then the moderating factors, including social support, community assets, and so on, leading then to personal health outcomes and population health outcomes as well. So in summary, unique combinations of exposure, susceptibility, resistance, and life history influence whether or not cancer develops. It's impossible to know how these components add up to a specific proportion of the total cancer burden. And I like to give a quote here from a paper by epidemiologist Dick Clapp and his co-authors, who said, "It's not necessary to propose a hierarchy or play one component cause off against another, fostering competition rather than collaboration." So I think an exposome framework explicitly acknowledges that multiple, multi-level chemical and non-chemical stressors over the life course influence cancer risk in the individuals and populations. This is quintessentially a mixture problem that's difficult to study, but it's the reality of the world. It moves us away from an overwhelming emphasis on individual behavioral change and adds programs and policies that also address workplace, school, community, and societal level contributions to risk. And this is just a final graphic representation of these ideas put together, where diet and other habits matter a lot, but so do occupational and environmental exposures. Mental and physical health status influence exposures as well. And then there's the whole collection of psychosocial and community level factors, many of which I've mentioned, collectively influencing the internal milieu and the various internal endogenous factors that influence cancer risk, many of which are shown here in this graphic, which then can, over a lifetime, influence cancer risk, both early in life, but also much later in life. So there I'll stop, and thank you very much for the opportunity to present today.
Great, thank you so much, Dr. Schettler. We'll be moving on to Dr. Whitehead's presentation momentarily. He's just pulling up his slides. Feel free to enter questions if you have them. Now's a good time, or anytime during the rest of the webinar.
Okay, thanks, Hannah. So my name is Todd Whitehead, and I'm here from CIRCLE, which is a Children's Environmental Health Center at UC Berkeley. And we're trying to deal with a lot of the complexity that Ted was just talking about and looking at one particular cancer, childhood leukemia. And today we're going to be talking about sort of how do you take that complexity and communicate it in a meaningful way to a particular group of stakeholders, which are the pediatric oncologists and hematologists who work with patients in our area. And I feel a little bit nervous about being the person who's asked to give this presentation because Maria and Ted, Maria, our moderator, and Ted, our previous speaker, are both sort of the two of the primary authors of this story of health project, which I'm going to be talking about today. I'm going to just try to share my perspective as a member of CIRCLE and how we try to integrate our science into this research translation project. And I'm also kind of representing one of our colleagues from CIRCLE, as well as from the Western States, PESU and OEHA, who's Dr. Mark Miller, who was also one of the primary authors and development team members for the story of health. So where did the story of health come from, and why were we interested in contributing to it? Well, there's a scene in the story of health that sort of sums up why it's important to look at research translation. And it's this image here of Stephen, who is a child who has leukemia in the story of health. And his parents are asking their doctor, Dr. Baker, what is it that caused his disease, and why was it our son who got leukemia? What are the factors that really contributed to the disease? And this is a common concern for parents who have a child with leukemia. They want to figure out what it was that happened. And Dr. Miller, as a pediatric specialist himself, was interested in looking at how doctors responded to these sort of questions. And this was sort of, along with his colleagues, one of the conclusions that he found. Epidemiological studies worldwide have provided substantial evidence of the contributions of environmental exposures to the development of childhood leukemia, yet this knowledge has not been integrated into the routine practice of clinicians who care for children with this disease. So in our own center, we've had several findings that have linked environmental exposures to the risk of childhood leukemia, but this isn't really information that the doctors themselves are comfortable sharing with their patients. And that was sort of the motivation of a story for health, story of health, to try to make this information a little bit more meaningful and usable for the doctors so that they could relay the information to their patients. So here's a little bit of a closer look at some of the responses that we got from this pediatric oncologist population. So Dr. Miller and his team had a survey of 191 pediatric oncologists, fellows, nurse practitioners, and asked them about their attitudes and practices towards sharing information about environmental exposures as it related to the cancers that they treat. And what Dr. Miller found was that, yes, indeed, a lot of the doctors were receiving questions from the families about identifying the links between environmental exposures and the cancers that they were treating in their practice. So 88% of the population reported that they did have those kind of questions from their families. And 77% of those doctors and nurses did suspect that some of their cases had some sort of environmental origin. So they did believe that there was a potential that the environment was having a big influence on these cases that they were treating, but 93% of the survey respondents were not very comfortable discussing environmental sources of exposure with families, and they gave different reasons for this, including sort of concerns about not wanting to make the families feel guilty or anxious about what they had done in the past. But it is useful to be able to discuss the environmental causes of disease with patients. And the idea of the story of health was to sort of allow the pediatric oncologists, nurse practitioners, to have a better sense of how to communicate this information. And these are some of the key features of A Story for Health. It's a really engaging format. It's told through this hypothetical family reunion format where there are different chapters for different family members around the table. And the leukemia story is Stephen's story. Here's Stephen here in the middle. But there are other stories about infertility and reproductive health, asthma, developmental disabilities, cognitive decline, and I think there's, well, the cognitive decline is a newly planned chapter. And each one of the family members has their own sort of backstory about how they can provide information about what the cause is and the contributing factors are for each one of their conditions. It's a multimedia project, so you get a lot of this really great graphic art that was done by Stephen Burdick, as well as a lot of video pop-ups and a really colorful design. It's got sort of different levels of information. So for the person who's just interested in a top level view, they can read through the story, get the narrative, and get a lot of the information from that, but it's not really technical. And there's an additional layer to it where there's actual charts and graphs from papers and manuscripts that get into sort of the technical findings, which could be useful for some doctors and nurses that are keenly interested. And then there are references to go and find the information in even greater detail. There's all these pop-up windows that sort of enhance the experience and allow you to expand the amount of information that you're getting from the story. One really neat thing about the project is that it's been accredited by the CDC's ACCME, and that means that it's part of this continuing education process for health professionals, and they're able to take the story of health freely and then get some continuing education credits for completing the process. And the part that's really related to my work is this idea that everything in the story of health is scientifically rigorous. So it's all evidence-based and based on the current state of the literature. So from Circle's perspective and from my perspective, the way that we got involved was sort of through this idea of being part of a translational research framework. This is a framework that's developed by one of our funders at the center, which is NIEHS. And it's showing sort of this expansion of information, knowledge, and ideas from basic science or fundamental questions out to like a societal broad impact. And what we want to do as a center is go from the purple ring, where we're doing mechanistic population-based studies to understand the causes of leukemia, and take that information and through projects like the Story of Health, turn it into actionable items, actionable information that people can use to actually avoid future cancer cases. So here are some of the nodes that we kind of are touching in this Story of Health project from our center. So our center's produced a lot of robust evidence that there are specific environmental exposures that can increase a child's risk for getting leukemia. But as we saw with the survey, the clinical oncologists are not comfortable discussing these risk factors for childhood leukemia with their own patients. So the Story of Health is designed to synthesize the current understanding of the childhood leukemia etiology for this clinical audience. And then there's this additional layer of value analysis where we're actually going to check to see if the program's effective by tracking the accreditation registration counts, looking at feedback surveys from the clinical community, and also listening to some testimonials. So forgive me for a little bit of animation here. This is just the process going from the clinical practice where Mark Miller and his team did the survey back to the sort of group and population level where we're looking for causes of disease, synthesizing that research, testing the story of health tool, and then analyzing the value and taking that back to the clinical practice and hopefully coming up with some new ways and procedures of dealing with communicating this information to patients. So I'll walk through a couple of the updated slides and pieces of the story of health. So this is sort of right in line with what Ted was talking about earlier, the complexity of the interactions among many variables across individual, community, and societal levels. Leukemia is definitely a multifactorial disease, including impacts from nutrition, genetics, chemical toxicants, infectious agents, immune function and development, as well as broader social determinants of health. And it's rare that one particular thing is responsible for health or disease. And of course, in this case, it's definitely more than one thing that is playing a contributing role. So as I said, the project is evidence-based. Everything in the story of health is based on the current literature. And for the most part, we really try to lean on this Childhood Leukemia International Consortium, which is a consortium of 33 different studies from about 20 different countries around the world that all have basically case control studies of childhood leukemia set up. And they've done pooled and meta-analyses of their individual study results to try to get more international consensus about what the risk factors for the disease are. In the pooled analyses have tens of thousands of leukemia cases, which gives us more power to detect specific risk factors in different subtypes of leukemia. All right, so for example, one risk factor that we'd want to talk about in the story of health is pesticides. It's been shown with many studies from around the world that pesticide use in the home and occupationally seems to have an association with childhood leukemia risk. And we want to provide these technical findings to health professionals so that they can use them, but we need to translate that research in some sort of a meaningful and useful way so that they can really help their patients and not just worry them. So this is an example of one of the pages from the story of health. It's got the sort of non-technical description on the left side. This is sort of the storytelling area where it's continuing the story of Stephen and his parents as they're discussing with the doctor, and it has sort of a running narrative from page to page. On the other side, we have some actual technical findings from CLIC, the international consortium that I just mentioned. So this is showing all of the findings from the different studies. You get a sense for how much consistency there is and the power of the association. And then there's a brief technical summary that sort of explains in what you would see like at an abstract level of a manuscript what the findings were. And then there's the citation to the actual paper where the audience could go and get more information. In addition to that, there's sort of some how-to information here about what this meta-analysis chart actually is supposed to be explaining with two different pop-ups there that give the reader more information. And then there's some additional information from other places like this pesticide regulation information and a link to the EPA website for more information about pesticides. And then, as I said, it's a multimedia presentation. So there are these video clips that have short informational topics that are related to the page. And this one is the PI from our center, Dr. Catherine Metier, talking about pesticides and leukemia. And we go through with the updated pages in the chapter and just talk about some of the recent findings, some of the recent risk factors that have been identified being associated with childhood leukemia. Again, largely leaning on this results from the Childhood Leukemia International Consortium. So that consortium has found that vitamin supplementation, folate supplement, is a protective factor for leukemia, whereas heavy coffee consumption seems to be a risk factor during pregnancy. There are also potential co-benefits of preventing other diseases as well. So in this case, the association with alcohol in childhood leukemia is not a very consistent one, but since there is some concern that it might be a risk factor, and it's certainly a risk factor for other health outcomes at birth, we are including it here as another thing to avoid. So we're encouraging prenatal vitamin, fruits and vegetables, and discouraging alcohol and caffeine during pregnancy. And it's all part of this separate series of infographics that was designed to encourage parents to start thinking about ways to protect their children's health very early in their life stage, even before they were pregnant, if possible. Here's another example of one of those infographics that we added to the Story of Health recently. This one's about smoking. This is sort of interesting because the smoking story in childhood leukemia is incredibly complex. The initial thought was that maternal smoking would be the risk factor for childhood leukemia, but a lot of the initial case control studies that were using interviewed data were negative or null. More recent findings that are pointing to specific at-risk populations, maybe Latino children seem to have a specific risk related to maternal smoking. And this is related to using the consortium in a way to get a larger cohort to look at and have more power to look at these subpopulations and subtypes of leukemia that also seem to be uniquely sensitive to smoking. But mostly what we see is that paternal smoking before conception is the risk factor for ALL. And we're discovering new ways of sort of assessing this, including looking at genetic deletions that occur after maternal or paternal smoking before birth. So taking this picture and turning it into something that is synthesized enough for a doctor to be able to digest and then share with his patients or her patients, I think is a real trick to doing a story of health. And then again, we have all these potential risk factors that seem like they might be disparate, but there might be some common threads here. So paints, solvents, traffic have all been associated with childhood leukemia in the CLIC consortium, as well as with a CDC meta-analysis. And there might be some common threads tying these things together, for example, like benzene. And we sort of added a new element to the Story of Health chapter about childhood leukemia, this great video from Bruce Lanphier that's called A Cause or Cure. And the questions that it raises are these here. Can we be more proactive about preventing cancer? What are the interventions that we could take to reduce exposure to risk factors for cancer or for specifically childhood leukemia? How could we develop cancer prevention programs? And because the critical time windows for childhood leukemia are so early, potentially even before conception, we really have to tackle this in a proactive way. So that's a huge challenge and one that I'd love to talk more about when we get to the discussion. So just closing with some of the success stories of the Story of Health. There's been over 10,000 people who have registered for the continuing education credits, over 750 for the leukemia story, in particular that chapter. Pretty much a general consensus that the content and the learning materials did fill a knowledge gap. But more than that, there was also a huge majority of people who were saying that they would apply this information in their practice and that they would be able to take these knowledge and skills and use them to develop strategies and provide intervention. So that's really the exciting and encouraging part of this. This is some more art that's included in the Story of Health from Susan McFarlane. She allowed us to reproduce that in the Story of Health very generously. And there are also some testimonials that provide sort of a great sense for what the Story of Health has provided to the clinical community. One of the best online courses I've taken, very interactive, and an excellent idea to use the storytelling. And then this other person is saying, I'm a clinical instructor. I'm going to transfer this knowledge and use it in the course for my nursing students in a child health practicum course, which is really great. And then the last comment is, I was already able to take some of what I learned and apply it to my own cancer support class. So again, really encouraging. And if you want to find the story of health, it's at the Western Pastry website. Here's the link. And now I'll turn it over to, open it back up to Hannah for questions.
Great, thank you, Dr. Whitehead. Now it's time for our Q&A session. You may type your questions through the Q&A feature available on the menu bar at the top of your window. We will get to as many comments and questions as we can. Maria, would you like to read out any of the questions we received? Looks like we're still working on questions.
Yeah, so I'd like to just make a couple of comments about the presentations. I thought those was really an excellent transition from Ted's with the macro overview, and then Todd zeroing in on this fictional case study that we developed for Story of Health. And I did want to also note that some of those infographics that Todd showed, he actually created himself. So in addition to being an incredible scientist, he's also a creative designer as well. And also wanted to note one of our major partners in this project, which has been going on for about 6 years now, has been the Agency for Toxic Substances and Disease Registry and CDC. And one of their artists, Dan Higgins, actually did also quite a number of the major illustrations for the project. And we also had a partner, the Office of Environmental Health, or OEHA, at Cal EPA. So I'm looking at a question from Maria. And the question is, regarding exposure during pregnancy, do you have studies or references on cosmetics and or hair painting and child leukemia? So I guess that would be for you, Todd.
Okay, I don't have any. We haven't done that in our study, but I'll look it up and get back to Maria on that.
Okay, great. That's great. Okay, here's another question for you, Todd. And this is from Shira. The Story of Health is truly a gem. I am curious as to whether the group has done similar types of knowledge translation targeting stakeholder groups other than medical practitioners. I work with the National Collaborating Center for Environmental Health. We specialize in knowledge translation for the public health community. For example, environmental health officers, medical officers of health, child care facility operators. Are you aware of similar types of resources available or being developed for these types of stakeholders? I could make a comment before Ted does to you, Shara. Actually, Story of Health was designed to be accessible for a variety of audiences, including health advocates, health educators, and so forth. So it's not just for the clinical community, although offering the continuing education credits has been an attraction for the medical community. Todd, Ted, did you want to? Yeah, Ted, did you want to?
Just briefly, the question is also, are you aware of similar types of resources available or being developed for these types of stakeholders? I'm sure there are. The emphasis might vary from one to the other. I know that some folks at Boston University, for example, have developed some really good materials for helping communities and public health officers make decisions about how to address or whether to address certain contaminants in their communities, like water contaminants or air contaminants. So that's just an example. But I agree that it's a need, that there need to be more of these resources that reach out to the broader public health community, including community members themselves and their community groups.
Yeah, thanks, Ted. And just a note that throughout the stories that we have, the chapters that we have in A Story of Health, and the chapter on cognitive decline will be released shortly. But on all the other stories, and in that one as well, we have links to a lot of those resources. That health studies guide that Ted just referenced, that's done by the BU Superfund project, and a whole wealth of other resources. So delve into that, and you can find some of those other resources.
Can
Okay,
I add something on to Maria? So I would say the part of our center that helped contribute to the story of health is the Community Outreach and Research Translation Core. Because we're a Children's Environmental Health Center, we have this mandate to have outreach and a research translation core. So we do spend a lot of time, and that's an effort that's led by Mark Miller. We do spend a lot of time thinking about ways of translating our research findings to the general public as well. So some of the projects that we've done in the past have been the infographic series that's also borrowed for the story of health, as well as some informational videos. We have a photo novella and a sort of stop image puppet film. I'm not describing that perfectly, but we have another contributor named Vicki Leonard who does a lot of that research translation effort for us. And I know that she does have some resources that are specifically tailored to the childcare setting as well, although they're not tied to leukemia per se. So I could share those resources with you. A lot of that stuff is available on the Circle website.
Yeah, thanks, Todd. I neglected to mention that that's a whole wealth of interesting resources for a variety of health educators, including community health educators that are available to use. Okay, so we have a question from Roy. Why limit to any single disease? People want overall health, not just avoiding any single disease.
Well, I think would all agree with that. People do want overall health. We chose some specific disease entities in the story of health because we wanted to get down into some of the details. But you'll notice that in my slides, my opening slides, those graphics that showed the life course and then the multiple exposures and the various factors that create some resilience and so on, those could apply to virtually any health outcome, and in fact do. So while this is focusing on cancer prevention, those concepts apply to virtually the entire disease spectrum and health spectrum.
Yeah, that's a good point for our center as well, because childhood leukemia is a pretty rare disease. We are always trying to think of ways to take the information that we're generating and make it impactful to a broader community and to more health endpoints such as leukemia. So we try to do that by looking for co-benefits, intervention points that would impact and alleviate more than one disease, essentially. So things like encouraging people not to smoke, that kind of thing.
Yeah, and just to say that throughout all of the chapters in A Story of Health, there, at the end of each one of them, we have a section called Common Themes, and there are common themes that resonate across each one of these diseases or conditions that we chose to highlight, simply as a way to be able to highlight various environmental influences on health. So good point, Roy. Okay, next question comes from Camille. This would be for you, Todd, I think. One slide mentions home remodeling activities as associated with risk, which is widely unknown. What is the best organization or initiative which works to communicate this type of information to the public?
Yeah, so a lot of the information in the Story of Health is based on the consortium that I mentioned, and it has a sort of consensus of several findings from different studies to rely on. That home remodeling finding, although it's interesting, is not one that has a lot of other studies to confirm the same result, because it isn't something that a lot of people have looked at. And what we think might have been happening there was that home remodeling was acting as a surrogate or sort of a stand-in for the kind of chemicals that can be present in building materials. So I think that a prudent approach might be trying to identify the specific agents that are responsible for that finding, and then going after those things. So things like flame retardants, for example, would be one hazardous chemical that we've identified in our study that would be present in building materials, and might be the kind of thing that home remodeling might generate and kick up into the air. So I think that that kind of approach would be the way to go. Try to get a little bit more specific about that particular finding, and then build from there.
Yeah, I would just add that any of the organizations that are focusing on environmental influences on health would be useful, such as Safer Chemicals, Healthy Families, or the Alliance for a Healthy Tomorrow, and others, because that those kinds of risks to the types of materials that Todd was mentioning, solvents and so forth, can have other kinds of health effects. Ted, did you have anything to add to that?
No, I don't.
Okay, so we have one other question here from Jane. In your experience, how do we convey the complexity of factors for the development of cancers, moving past behavior and individual responsibility, and make connections to structural and systemic contributions, especially thinking in context of the communicating with the media, politicians, communities, and in the current historical moment of climate crisis and health and environment connections? Ted, you want to take that?
Well, Jane, you've pulled back the curtain on the important question here, because it's a question about how do we convey the complexity. It's a question about communication and getting people's attention. The story of health and other efforts are sort of laying out some of these structural and systemic contributions that you've identified, but getting people to pay attention to them and doing something about them is always a struggle. And quite frankly, it's a political struggle as much as a scientific struggle, particularly in the United States, where we are seeing right now efforts to roll back clean air standards, when we've just been describing how air pollution contributes not only to leukemia risk, but also to lung cancer risk. It's a structural systemic problem, and we have efforts underway to try to make this worse. So I think we just have to call it for what it is, and try to find the political will to resist this kind of rollback of public health protections. So yes, it's a tough communication problem, and it's also one that just is going to require a lot of political action as well.
Todd, any thoughts on that?
It's a really great question. From my perspective, I want to be able to provide information that someone can use and feel empowered by, and not only provide information that is sort of discouraging. So in that end, I think that it is useful to continue to at least offer some personal behavioral kind of ideas or tips, for example, how to avoid exposure to a particular risk factor. But I agree that the problems are bigger than just a single household, and it has to be sort of a multi-front approach where there are also efforts to make bigger changes. So for example, with flame retardants, we are providing tips for how to reduce a child's exposure to flame retardants in the home. But at the same time, people in California were working to have the standard for flame retardant testing changed so that these chemicals weren't coming into the homes in the first place at the same sort of consistency that they were 10 years ago. So again, I think there's kind of these micro tips that you might be able to offer that could help people within their own homes, but then there's also these bigger factors and bigger forces that have to be taken on as well.
Yeah, I would echo both what both Ted and Todd have said, and throughout our many years of working together, we've always felt that in sort of the inside-outside approach is necessary. So an informed electorate and citizenry that can advocate for better policies, and then an informed political and policy maker class is also important. We have to constantly have both of those things happening. So Roy just added a comment about remodeling, that remodeling in a healthy way is taught by building biologists, for example, George Swanson. And I do know there are, the Healthy Building Network, there's green building, there's conferences addressing smarter growth and smarter building and so forth. So those resources are out there, and we just have to keep supporting those. So that is the last question that I see, Hannah. I think we're coming up close to the top of the hour, unless anybody has any final thoughts, Ted or Todd, to add. We can probably close this.
No, I'm all set. Thank you, Maria.
Thanks everybody for listening.
Yeah, great. Thank you so much, Maria and Ted and Todd. We're approaching the end of our webinar, today's webinar. A video recording will be available on CHE's website soon, and tomorrow you'll receive an email containing a link to the video. If you are new to CHE and would like to stay updated about upcoming events or more, please sign up to receive our newsletter by selecting the Join Us tab at the top of any page on our website at healthandenvironment.org. Additionally, if you appreciate the CHE Partnership webinars bringing you the latest environmental health research for free, we encourage you to support CHE's ongoing work by making a tax-deductible donation via our secure website. Again, our website is healthandenvironment.org. With that, I would like to thank our speakers, Dr. Schettler and Dr. Whitehead, for taking time today to present, and to you, Maria, for your excellent moderation. Thank you again, and thank you so much for joining us, and have a great day.